Quick medical tip, you don't need antibiotics for your acute bronchitis. And for that matter, you don't even need a chest x-ray to sort it out. And for that matter, you don't even need to go to the doctor. At least this applies to most of you. As with all my other videos, this applies to normal, healthy people, people that don't have other comorbid conditions like chronic heart or lung problems or some type of immune system suppression that's going to make you more likely to get infections. And as always, do what you think is right for you. Don't trust the dumb guy on the internet. That said, there are millions of visits for bronchitis every year to family doctors, urgent cares, ERs. Over 4 million was one number that I saw. And the majority of patients that come in think that they need antibiotics for their bronchitis, and it's simply not the case. There are two major types of infections. There's bacterial infections and viral infections, and over 90% of the cases of bronchitis are due to a virus. So the antibiotics are actually not going to do anything for you. Patients always say, well, I get bronchitis every year, and I always get antibiotics and I get better nice and quick. But the thing is, you're getting better at the same rate that you would have whether you got the antibiotics or not. They're not actually doing anything for you. It's kind of a placebo. It's kind of like kids with ear infections. There's a saying that if you put the kid with the ear infection on antibiotics, they get better in a week. And if you don't put them on antibiotics, they get better in 7 days. So it's just not going to do anything for you. Symptoms of bronchitis, the biggest thing is that you get a cough. Bronchitis is an inflammation in the airways of your lungs, the bronchial tubes, and it can produce some inflammation and mucus, and you often will cough that mucus up. The cough can be either dry or it can be productive. And the sputum color can be several different colors, from white to yellow to green. And another interesting fact is that studies also show that the color of that sputum doesn't indicate whether it's viral or bacterial, so that's not even going to matter. It can also be bloody. If it starts out bloody and it's pretty bloody, that's a concerning finding. However, if as you've had this ongoing hacking cough for a while, it becomes gradually slightly blood tinged, that's less concerning because sometimes you can get some irritation in there and cough up a little bit of blood. And again, that's less concerning. You also can get a soreness in your chest. You can get a sore throat. Typically, people that have bronchitis will have symptoms from here to here, and they'll a lot of times get a concomitant upper respiratory infection. I'm just getting over one of those myself. And so they'll get chest congestion, chest soreness from the coughing, sore throat, which is also viral, don't need the antibiotics, stuffed up nose, head congestion, low-grade fever up to like 100.4, 101. As a side note, buy a thermometer. It amazes me how many people come in, I don't know the percentages, but this 90% number also sounds good, that I say, have you had any fevers or chills? Oh yeah, I had a high fever. How high was it? Oh, well, I don't know. Oh, you don't have a thermometer? No. No one has a thermometer. The one, as an extra side note, one woman, I said, she had cold, upper respiratory infection symptoms. I said, have you had a fever at all? Yeah, 115, 117. I said, you mean degrees like your temperature? Yeah, 115, 117. I said, did you take your temperature? No, I couldn't do that, but I felt real warm. I said, well, like that Tylenol really kicked in, you came down 17 degrees. I've had 2 people with temperatures over 110, at least that's what they thought. So buy a thermometer, that way if your temperature's over 110, you'll know it, and you'll know that you probably ought to go see someone for it. Buy a thermometer, spend the $5, it will give you some useful data points. Anyway, taking antibiotics, like I said, they don't do anything for you. What they're going to do is they're going to take your money. Some are more expensive than others. You're going to get the side effects from them. You can get the side effects from them. Diarrhea, nausea, upset stomach. Worst case scenario, you can get a antibiotic-associated diarrhea called Clostridium difficile colitis or C. diff colitis that can make you pretty sick. You can have an allergic reaction to the antibiotics. And also, taking the antibiotics when you don't need them will increase the overall bacterial resistance in the community, so it's going to affect things down the road. So taking the antibiotics is not a benign process. It's not a, well, I'll take the antibiotics and there's no downside. Well, there are some downsides. So if you don't need them, don't take them, because there are some downsides to them. The big thing not to miss, though, when you have bronchitis is that you don't want to miss that you have, or that someone has, a pneumonia, because in that case, you do need antibiotics. The thing is that in healthy, non-elderly adults that have normal vital signs and a normal lung exam, pneumonia is very unlikely, and chest x-ray is not even indicated to sort it out, and consequently, antibiotics also not indicated. There's a nice little flow sheet here that I will put up on the screen, and I'll put a link to where I got this flow sheet so you can see it, give credit where credit's due. But you can see here that starting in that upper box there, you want to assess the clinical probability of pneumonia. If you go to the right, if you're old, there's a good chance that you might have pneumonia and you're going to get a chest x-ray and possibly be treated for it. And then that next left one, that low probability, I would say again is probably 90% of the people that I see. The majority of people that come to the ER for their bronchitis, I'd say, are between 18 and 45, generally healthy, maybe they smoke, and they often have normal vital signs. That is, they don't have a fever, they don't have a fast heart rate, they're not breathing fast, and they don't have their oxygen saturation is normal. And then they have a normal lung exam. They're not wheezing, they don't have crackles on one side, their lungs are overall clear. I'd say that's 90% of the people that I see. And in those cases, chest x-ray is not indicated and antibiotics are not indicated. The treatment is just symptomatic, which I'll get to in a bit. The other two, the intermediate and the high probability, if you have abnormal vital signs or an abnormal exam, well, that's the case where you need to consider chest x-ray and possibly some antibiotics. So given the fact that you've decided that you don't need antibiotics, the treatment for bronchitis is symptomatic. Take some anti-inflammatory, take some Tylenol, some Motrin, some Naproxen. I'll put a link to my pain medicine video that I did, because I was taking the Motrin 800s when I had the sore throat last week, and I could tell when it was working. It amazed me how well it worked. I could tell when it was working, and I could tell when it wore off. So anti-inflammatories, rest, fluids. If you smoke, stop smoking. I don't know if you know, but smoking is bad for you. Maybe you've not heard. Smoking will make the infections take longer to clear out because your lungs are not moving things through as much, and it's going to make you more likely to get infections, and it's going to cost you money, all sorts of downsides. Smoking is bad. Stop smoking. And eventually you'll get better. Just kind of ride it out. Other things to do when you have it: cover your mouth when you cough, especially when I come in to see you. Don't hack all over me. So don't spread it to other people. If you're going to sneeze, sneeze into your mouth, or sneeze into your hand rather, and then wash your hands. Lots of hand washing. Now, there are some times when you do need to seek medical care. If you've got a big fever, if you've got a temperature over 100.4 or over 101, if you're coughing up bloody sputum or super thick stuff, if you are short of breath, if you're having trouble breathing, if symptoms have been going on for over 3 weeks, or if you're getting recurrent bronchitis, which could be a sign that you've got some type of immune disease, you probably ought to go get it checked out. Also, people with chronic heart or lung problems, or people with some type of immune deficiency syndrome, or if you're on chemotherapy or cancer, something like that, you probably ought to get checked out. Also, one other indication, most part the symptoms, like I said, it's just a matter of managing them at home with over-the-counter cough medicine, all this stuff. When I get it, I swear I'll go buy the cough medicine. None of them I don't think do anything for me. No matter which ones I get, none of them help. There's tons of different cough medicines. If you find one that works for you, great. But occasionally the cough medicine is just not quite cutting it. Come see us, we can give you some better stuff, like some Tessalon Pearls or some Phenergan with codeine, or there's some stronger ones that could work. Sometimes a course of steroids will help. Sometimes an inhaler will help if you're wheezing. Just kind of depends. But for the most part, you're probably not going to need antibiotics. So that's about it. Take note, next time you go to the doctor, you probably don't need antibiotics for your bronchitis. Stay home, be well, feel better. Catch you next time.